This article I've always found very important because it had a profound impact on how I think about how Parkinson's disease impacts people with Parkinson's disease. And therefore, it has had a major impact on how I look after people with Parkinson's disease. It wasn't the first article to talk about quality of life in people with Parkinson's disease, but it probably still is the biggest study looking at what are the things that impact on quality of life. And I think the most important factor is that unlike what someone might guess, it's not actually motor disability or physical function or even medications that have the greatest impact, but it's actually people with Parkinson's disease level of depression that has the most impact on how they feel about their day-to-day life. Roughly only 17% of the factors influencing quality of life in people with Parkinson's disease were related to motor disability or medications. But when one added depression scores, then about 60% of the variance in quality of life could be explained. And what that means is that if you want to look after someone with Parkinson's disease and make them feel well and healthy, it's not only just as important, but probably more important to make sure that their mood state and their mental health is in a good place. I think the other really important thing is that satisfaction with the explanation of the diagnosis, as well as current sense of optimism, also had significant independent influence on people's quality of life as well. And so what is explained to someone about their Parkinson's disease and how they're guided in terms of how to feel about how Parkinson's disease might impact them and what might happen in the future has a long-lasting impact. So what one says to someone with Parkinson's disease at the very beginning can actually influence the course of that person's experience of their life and quality of life and Parkinson's disease. The study was reflective of how people around the world with Parkinson's disease feel rather than just a small group of people from a single country. It involved over 200 clinicians, and not just clinicians in specialist Parkinson's clinics, but in day-to-day neurology clinics as well. It was actually one of the early studies that involved patient perspective and carer perspective as well. I think that this study that was published in our flagship journal, Movement Disorders, now over 20 years ago, really was one of the early studies that taught us of the importance of actually thinking about patients and caregivers and integrating their viewpoints and also their welfare in all the activities that we do as clinicians and as the Movement Disorder Society as well. I do think that it's probably underestimated how important depression and mood is, especially for those clinicians who might not read widely about Parkinson's disease, who may not be movement disorder clinicians. All neurologists around the world look after lots of people with Parkinson's disease. And if one isn't aware of this concept, then I think people can actually fail to deal with what's most important to the patients. It really has impacted my practice for over 20 years, and hopefully those who read it will actually have it change the way that they look after people with Parkinson's disease.